Haka kendai tarik Jymmang ar hajar arpu ar ka Samkhamti ryngkat ka Kripa Foundation Shillong ka Meghalaya Arts Control Society bat ki doktor ka Bethany Hospital ki la pynlong ka jingiakynduh lang bat ki lat pathai khubor man pynsngew lyngba jong ki ya ka jingthmu ban pynlong ya ka medical camp ne ka jingai jingsumar ka ba shisngi ka ba on sa pynlong haka Samkhamti Parking lot ha Urkaliar Shillong. Haba iakren bat ki nongthoh khubor hak Shillong trai jong ka Samkhamti Parking lot Bah Sam Diengdoh iathuh ba ya ka jingthmu ban pynlong ya katei ka medical camp ka ba shisngi kalong ban pynshlur ya ki khana samla bat ki khana ki bala kerni ha ki jingdi buat kum udrok bat ka kiat bakin wan chakmat khanang ba onla ban pelaj bat bathat chisundon na pdeng jong ki ya ki tei ki jinglien ki basnio.
So Samkhamti, in collaboration with Kripa Foundation De-Addiction Center for Juveniles, Kripa Victoria Senior Citizen Home, Kripa Foundation IRCA, Bethany Hospitals and Meghalaya Arts Control Society. This is the first medical camp pertaining to drug alcohol abuse, a platform for women above the age of 65 to be enrolled into a private senior citizen home and a general medical screening for all. The number of cases, since you had asked me, sir, about the number of cases in De-Addiction Center of Juveniles. So the number of cases admitted to Kripa De-Addiction Center for Juveniles have been alarming since its opening in July 2021. We have taken care of till March 2022, from July last year till now. We have taken care of 45 IPD cases and close to about 60 OPD cases. So that is quite an alarming number. As of now, from the Nongthoh police station, we have almost about 60 under 18 users that are yet to be enrolled in our program. The reason why we are unable to admit them right now is because we are already full. We have more than 15, soon I think 19. We had to increase the number of beds, so we are totally full right now, right? So the age group is decreasing drastically, and we as Kripa Foundation are trying our best to raise awareness in hotspot areas as much as we can. Reason why we teamed up with Samkhamti is because that particular belt is a hotspot area. Right, so the number of users, number of cases that are rising, even from the peddlers, it is absolutely alarming. So we picked that area so that it is, so to speak, enforced that this particular camp is actually happening, and they have that offset to be part and parcel of that program. See, today, for example, there was an organization that came by. We've decided to also enroll them. There'll be a TB, tuberculosis test that will be done in the morning for spot test, or people who come in the evening can register and get the test done the next day or at a later date. You know, so an HIV screening test will also be conducted in this program. Right, so why are we doing multiple various tests? Like there's a dental, there's an HIV detoxification. Reason is because if we do a specific particular camp for, let's say, only detoxification counseling, then there's just a certain number of people will come. It becomes a little more stigmatizing, and there's taboo related. But when we give a general treatment to all, the advantage is that now their parents can come in for an eye test, but also send their kids for HIV test, or be it any other test related to drug or alcohol abuse. Now the highlight of this camp goes to a certain individual who is taking up the initiative to take a bold step forward, which is Mr. Sam. You know, he is very much, as people who are aware, he is very much from the liquor industry, but he is stepping up to fight addiction related ailments. This is a tremendous landmark in Meghalaya, and this is an honest implication that corporate social responsibility exists in direct relation to the field that they are working in. For instance, liquor companies, retail outlets promote their sales through, let's say, music events, festivals, tourism related activities. But for Mr. Sam to take up this initiative is very courageous, right? So you had some questions about who will be paying for the medical camp, etc. So a request to all participants for this program to please bring their BPL or ration cards or a letter from the Rangba Shnong, respective of the Dorbar Shnong, to avail all services free of cost, such as consultation, investigation and medicines. Right? So investigations are like blood samples, urine samples, etc. The rest of the public will receive consultations for free. However, investigations and medicines will be charged at a very nominal rate. Like the doctor had suggested earlier, that there'll be some free samples. Those will be availed for free. And any medicines that we receive for free from companies or from the government, those will be specifically given out for free. So the ones that let's say government or the companies have not given it to us for free, those will be charged, not at MRP but probably lesser at distribution price. Okay, so we look forward to your participation for this event, and we would like to thank all well-wishers and donors that have been playing a massive role in helping us gear up for this event. Yeah, so God bless. Describe hotspot areas. Hotspot areas are basically, from our data, maximum number of people that actually get admitted to our rehabilitation center. We look at the address. Point number one. Point number two is, what we've seen is where there's maximum number of street children or, you know, poor socio-economic statuses, we've noticed that there is a lot of drug infiltration. Be it peddling, be it using, you know, so we and also through the district social welfare, they have done a certain mapping where exactly maximum number of users will be at. So they've shaded they've color coordinated. Red shades means like extremely vulnerable. Orange shade getting to be very vulnerable, and you know, the greener shades, that is like, okay, you're so to speak free of drug zone. You know, so we map this out. This has come directly from the district social welfare. They've done a lot of that through the data that not only Kripa Foundation but various other rehabilitation centers, be it New Hope, New Life, Manbha, everybody is working in this field, right? So everybody is being able to pitch in what is a vulnerable area. Now, when it comes to alcohol consumption, I think the choice lays up to the consumer.
Yes.
I don't think Bah Sam goes out there and puts a bottle in everybody's mouth, right? Everybody decides on what they're drinking, right? And not and there's so many various brands out there. I don't think that it is one particular brand that is actually getting somebody addicted. That is why I've always said that alcohol companies, they should come forward, because that is the only way they can be corporate social responsibly, right? Where is that happening? We need to exercise that on our own professions, on our own portfolios, right? If we're going to start helping out some, you know, tourism industry, like I said earlier, or promoting brand events, that is for your own good. It's not for the welfare of the people. Corporate social responsibility is social responsibility.
Free medical camp camp bangila ya ngerjimut lang mental arbon item dia medical camp ka kami pher ni medical camp namar nelor jung gini ki jeng check up ki dan ko ka bolong konsan ba ka jingai bagi kimi pa menta kani ka jok ki syam di ha ka bagi bagi drug addicts ti kani ka medical camp ka bangi menta kande bangin dia counseling hiki drug addicts, especially juvenile kita bilang kena ti Sian ka Kripa Foundation bukan supply to ga de-addiction center jengki for juveniles, but consider the program ka detoxification ru kadi ka main program jengni ka free medical camp ti kaphang bakongsan ni bingilia ya kani ka free medical camp mangni po premises jong ka Samkhamti kalong ba ngi kwa ban keep it very secretive ba kita ki kena ki bawan there'll be absolute privacy in dan betip ru iki bikiwan tu ka Shillong bet tangka jingiakynduh lang bet pring jungki bat ki doktor tapi haban stu ba tentang kum kini ki camp medical camp kamtam ka badai ban address kini drug addicts lang ile high community hall jung di Shillong jungki tempat mo ang sinjik ya ba ki bikin wan markan sa arise ka stigmatization pikir kin suli rani ban wan tidak ka ba ngi yatim lang pada kini likely ki Kripa Foundation ke Max bagi doktor jong Bethany Society ngiliat lang nanti po Samkhamti Parking lot jong institution din tinggi promisi ru iki bakan dan bagi absolute privacy katei di ketang